Welcome to this community engagement program. Yep, this is where you will hear the truth, the whole truth, nothing but the truth, dealing with issues that is affecting our community. And guess what? I've got my very dear friend, and I can say that because we are often in this position at this time of the year, no other than the matron, Christopher Bernard, who's with us. And I'm so grateful. It's good to have you today. I really am grateful.
Good to see you again.
Well, we've seemed to have got another strain of a virus, and this one's different. It's known as the RSV.
Yes, or the respiratory syncytial virus.
Wow.
But short RSV.
Now, you have to tell us a little bit about this particular virus because it seems to come around a lot at this moment, and I think there is a lot of pressure from the government that we need to highlight this and really address it. Now, is that another strain?
It's not another strain, it's another virus. It's another respiratory virus. It's like a cold virus, similar to all the other viruses that are around, but it's specifically targeting the infants and elderly people because it's an infection that goes into the lungs, and it's a virus basically that goes into the lungs and then affects the deeper part of it. So you can get pneumonia. So that's where you need to be very careful with, and especially the younger, the weaker people in our community are the ones that we have to be very careful.
So if you're talking about pneumonia, could be also bronchial problems as well?
Yes, bronchial issues. You could have the bronchitis, especially with babies, but the younger children is what we're concerned about. So under ones. So those are the ones that that you want to be vaccinating.
Okay, so we're back to the vaccination. Now, I mean, is there a difference? Can you tell the difference from this particular strain, this particular virus? When you say seasonal, when does it appear? And can you tell it different from COVID to this RSV, as they call it? Strain. Is there a difference?
It's very tricky. It's a very because the symptoms are very similar to both COVID and flu. Runny nose or blocked nose, sore throat, cough, sneezing. So all things you would see with COVID and with flu. But specifically, it's the dry cough, the wheezing, children, difficulty breathing. Those are the ones that you'd be really looking out for.
Now, my research, I understand it's taken once, or do you need to take it every year?
It's a one-off vaccination, so it's only one vaccination that you get, and then you don't need another one after that. So unlike with the flu, for example, it's seasonal, it comes around every year, so it changes. So that's why the reason we only do one vaccination.
Okay, let's look at the age gap. Let's move towards this. How is the vaccine applied? Is it like any other vaccine, or is there anything different about this particular?
No, it's like any other vaccine. It's a one-off. It's a vaccination in your arm. It's in your deltoid. That's where you get the vaccination, and that's the same with both age groups.
How about when you talk about infants now?
Yeah.
Remember the last time we were here, we talked about where something can be administered up the nose.
Yes.
Is this the same?
That's not the case in this case, no.
Right, yeah. Next thing is, I'd like to talk about the whole idea of, mentioned about ladies who are pregnant.
Yep.
How do we deal with that in a sense?
So ladies who are pregnant will be concerned to say, of course, it's straight away what's going to happen to the baby that you're carrying, the unborn child. And of course, the reason why we vaccinate pregnant women, the reason we do that is to make sure that the child inside, whilst you're pregnant, gets protected by the vaccination that is given, that can go through the placenta that get given into, so the immunity goes into the child. So when the child is born, they already have a partial immunity as they are born.
Okay. Are you able, as I said, this is the first time I'm hearing about this particular vaccine, and obviously some figures may have been alarmed why we're actually broadcasting. Are you able to give some type of figures of where we're at this moment, why we're trying to highlight this, that people can be vaccinated against the RSV
It's because
virus?
it's targeting the elderly. Again, it's the weaker people in our community, the infants, and it's figures wise, it's very tricky to say, but again, it's a virus that is targeting the weak and the young.
Okay, so we want to advise. We've been told that there is a lot of numbers creating in this area. We want to cover pregnant ladies and also the unborn child. The symptoms are very, very similar.
Very similar.
But yet still, we just want to make sure that everybody understands it's important to be vaxxed. Where, as I mentioned the last time, where would individuals go to be administered this particular vaccine?
So this, at the moment, you go to your GP. So the GP will be the place that you get the RSV vaccination. We, as a team, as a roving team, will be able to administer that as well. And we'll be doing that at certain locations.
Okay,
but
so
your GP is the main place to go.
All right. So how can they tell? Who tells them whether it is a COVID vaccine or is the RSV? Is there? How do you know the difference?
You ask for them, and let's put it this way: the elderly will get a letter asking them to come to the GP to have the RSV vaccination. So they will have a letter that is sent to them. Infants, for example. Again, you can just go to your GP and ask for the RSV vaccination.
Okay. Now, here's the thing that we need to get over. The word vaccine. I mentioned the last time when I was in school back in those days, we used to have the MMR and what was it? We had BCG.
BCG, yes. Yeah.
I can remember my mum telling me to go, or we got a letter from the school. And it was not something that was in debate directly. And many of us may have a mark on our arm right now that would depict that we had our vaccination. Yes. But it seems that we're just full of technology now. We're asking questions, we're doing... How do we try to get the message across that these vaccines are safe?
That's the tricky part of having all the knowledge, which is a good thing. But also it's being informed properly, asking the right people for the right questions, and asking the right questions. For example, it's the important thing is that you ask the right people. The internet is full of you can find whatever you want on the internet. Is it positive?
I suppose you can, yeah.
Positive or negative.
Yeah.
So therefore, it's the trusted sites, your NHS sites. If you're not sure, your GP, your medical professionals. Those are the people you want to be speaking to if you have any queries or any questions with regards to vaccines. And of course, because of, we've said this before numerous times, because of COVID, there has been a lot of hesitancy because of it. There has been long scaremongering because of it. And of course, I've said it before, it's also partially because I think the misinformation that was given during the COVID times, where they literally said, and I remember it quite well, and they basically said, if you take the vaccination, you will not get COVID. And that's, I think, a lot of misinformation that was there, because what they should have said was, although you have the vaccination, you can still get ill, but it won't be as bad. And that's what I always say, the same with the flu, and that will be the same. Any vaccination you have is never 100%, but what it does, it protects you to a certain extent. So if the virus comes into your system, it will react and it will make antibodies, and it will then fight the virus that is there. And that is basically with any vaccination, it's not foolproof, and that's what you need to remember, but it gives you that extra, just a little bit more help, especially if you have a weak immune system, if you're elderly, if you're young when your immune system isn't as strong. That's when you need a little bit of extra help, and that's how you can see a vaccine has a bit more help to get you over that line.
Okay, here's the thing. Some people might not want to take the vaccine because I've got an existing condition. So I'm saying, will the vaccine be safe inside of me knowing I've got other medical conditions? How can we assure those listening today that this vaccine is safe and it will work with other...
As all other vaccines, they would have been rigorously tested, making sure that even people with underlying health conditions, for example, people who have had cancer treatment, people who are going through cancer treatment, for example, people who are waiting to go, it has been proven that you want to protect yourself even in this time. You lose your immunity, for example, in certain types of treatments for cancer. So therefore, you need to then build up your immunity. So either that be COVID, either that be flu, or that be RSV. it is always important. But again, if you're unsure, not 100%, always check with your clinician, always check with your GP.
You know, the next question I'm going to ask is always the thing about, here's another vaccine. Is there going to be another side effect?
In principle, so you can never say there's no side effects to vaccines, but what you can say is there'll be mild side effects to general, like all other vaccines. So generally, the injection site might be a bit sore, might be a bit red, might be a bit painful there or so. You might get a bit of a temperature, but generally there shouldn't be any side effects. But we always ask when you do come if you have any allergies, because what we don't want to have is that you get a reaction to once we give you the vaccination. So we make sure that doesn't happen.
That's so important because, people want to be safe, they want to be healthy, and they're being told, maybe it's government-led officials saying, this vaccine will support you. And people are always concerned about the side effects. And so I want to even talk about and push you a little bit further about the assurances. Mm-hmm. How can you communicate to the viewers about the assurances and the effects of these new vaccine that the individual is safe? What are the reassurances?
The reassurances are unlike again, a lot of skepticism with regards to come back to COVID, where it was made very, very quickly. Mm-hmm. Was it the right thing? There were side effects. There are still some side effects in that respect. Coming to RSV and coming to like flu vaccine, for example, they've been regularly tested and they've been around for a long time. Yeah. So they've gone through the process of the way they've been made, the way they've gone through the whole rigorous process of being checked and double checked. And that's why they are safe. And also that's why you also have the bodies to do so.
Okay, and here's the next question, because I've got my community, my black community, and I always want to say, is the RSV a real concern in the black majority community? Is it something for them to be alarmed? Are they going to say, it's another vaccine? Does it agree with us? Is my melanin going to cause the issue here? But how can we also communicate to the black community that they don't have to worry about this? It is safe in our community. It's something that will help our community. I have to stress this.
Yes,
what
absolutely.
would you say as a matron for the NHS spearheading or pushing this vaccine, especially as another strain, I would say the RSV? How can we be assured as a black community that this is something that will also work for us?
It's a virus. It's a virus that attacks the lungs. It's a virus that, if you're elderly or you have an elderly person in your home or a young child in your home, it's important to protect them. And of course, it is agreed. It is another vaccination. It is another one on top of all the ones that are already out there. But I do stress, and I think it is important to remember, it's a seasonal one. So it could be COVID, it could be flu, it could be RSV. We're not sure, but we're making sure by giving you the vaccination that we're protecting you. It's a one-off, so that's a positive in respect to the other two. But also remember, if your elderly member or even your young child gets ill, they may need to go to hospital. As you're aware, at this time of year, hospitals are overstretched. People ending up in corridors, sometimes hours and hours having to spend...
talk about the corridor situation.
having to spend hours in ambulances outside of the hospital.
Wow.
Before they can actually get a bed. And once they do get a bed, it takes a long time to then get them out. So again, stressing not only for RSV, but again for flu, for COVID. If you have those vaccinations, it decreases the chances of the weak in our society or weak in our community, your elderly, your children, ending up in hospital, and that not only just being in hospital, but everything that comes with that.
Bernard, I just need to ask the question. All right, you administer the vaccine, another strain we're dealing with here, the trust implication, people feeling comfortable to take this. What are the results? What have you seen that, it's something that is making a difference, that you could be on here talking to us to say, you know what, you may be afraid, you might think there's another vaccine, but it works. Have you got those assurances? Have you seen it in your daily work that people have taken this vaccine and their lives have changed, transformed?
Yes.
To say that you can stand up, you can be here in this studio with confidence to say, yes, this is why I'm doing this.
Absolutely. That's the reason we're here. That's the reason we're talking about it. That's the reason why I think if people look around in this last winter season, the number of people, again, wearing masks, I don't know if you've seen it yourself, but in hospitals, they were told to start, especially when there was really a height of the flu, could be RSV as well, that nurses, doctors had to start wearing masks in certain hospitals, or people coming in. I now see people even working in supermarkets, for example, and you see a few people wearing masks. And those maybe they're not ill, but they're concerned of getting it. And I think that's partially the reason why we are talking about RSV, COVID, flu again, because they're out there. We're still in the winter season. People tend to forget that because, you know, you start hearing the birds, the sun comes out, you think it's going to be spring soon, but we still have a few months to go before we're there. So it's, yeah.
Here's my last question. And it's not to scaremonger anyone, but I've got to drive this home. Could this RSV also be something that could kill us?
Yes.
Can we die from this?
Yes, you can. Especially those with a weakened immune system, those who don't have a very good immune system, like children or babies, and then of course the elderly, but your people with a compromised immune system, people who've had cancer treatment, for example, those are the ones. That's the reason why we do it. And yes, if you do get severely ill, yes, you can die from it.
Okay, here's a question then, as we wrap this up, because we're raising the whole issue of this new virus that's on the increase. That's why we're doing this interview.
Of course.
So if we know it's a bronchial pneumonia, the lungs are affected. Yeah. Before we get to that position, we need some signposts. So who do we move towards to say, look, who do we start to speak to and engage with if we feel something's happening in our body? Who are the first protocol that we should
When you
speak
start
to?
coughing, sneezing, feeling unwell, first protocol would be a GP.
GP?
Absolutely, that'd be your first one. If your GP is not reachable, 111, get in contact with them.
111, that's important. Yeah.
And if you feel and you're really out of breath, because that's what you need to remember, if you're really out of breath and you can't get out of bed, and it's getting to a point that you think this is not right, straight away 999, get yourself an ambulance, get yourself to hospital.
Over the desk, my pharmacist.
Pharmacists.
Do they have that knowledge?
Yes, they will be able to assist you, but GPs, pharmacists will be helpful. Yeah.
Well, folks, you heard it from my very good friend Bernard, who comes here, especially in this season, to talk about vaccines. And sometimes we put it off. We might go to our old remedies that we have, and we'll just kind of stock up on that. But I believe we're in a very special country, I would say. I'm grateful for it, that we have these at our disposal, our NHS. Yeah, they're overrun, they're busy. Bernard just mentioned about the corridor, and I love to have a conversation about the corridor situation. But if we think about it, it's because of these viruses that's causing the overload, why we're having so many people that's not well. And maybe that's a conversation for the next time. But Bernard, I wanted to give you this opportunity, if you wouldn't mind, just to speak into that camera and just to tell them the importance of your visit here. And if we feel that there's a symptom that's going on in our life that we need to address it, take this opportunity, take the floor and just speak into that camera.
Sure. If you are at home feeling unwell, have a dry cough, and it's been going on for some time, and you feel that you are out of breath, and that you feel that it's not clearing, best thing to do is to go and contact your GP, and if not, try and get yourself to the hospital. But the most important thing is not to get to that point. You want to do that before. So speak to your GP about the RSV vaccination. Speak to them about what the risks may be. They can give you a leaflet. and get there before you get ill at home. So the most important part is being informed, making that decision, because it is your decision. It's easy for us here to say, yes, you go and get it. But again, unless you're informed properly and want that, and then you take that decision, then it's the right thing to do. But again, from my side, all I can say is not only RSV is out there, but it's all viruses which are related to the winter, your flu, your COVID. Those are all things you've seen, especially as I mentioned already. You were seeing a lot more people wearing masks. You're also seeing a lot more people coughing on the buses. And don't forget making sure you wash, general hygiene. Wash your hands when you get home after being on the bus, for example, or on the train or public transport. Making sure you, if you do sneeze or you do cough, make sure you cover your mouth. Things like that, just general hygiene to protect yourself as well as others around you, because again, there are other viruses going around. There's norovirus going around. There's everything's going around. So it is that type of year. Because we're all inside, that is also the reason why where we are at the moment.
Thank you, Bernard. Let me just put the cherry on the top, I suppose. I love these particular community engagement programs because, trust me, I'm learning as well. I'm learning the importance of hygiene, the importance of making sure that I keep well, because I've got a lot of things to do, and I've always heard my mum says, prevention is better than cure. It's not every minister, and I will say that, can sit in this position and begin to talk about those important things that happens in everyday life and bring it right to where you're sitting. So I'm very fortunate to have friends like this that will come in, and believe it or not, I'm learning as well. And if this program could speak to someone that their lives can be prolonged or healthier, well, this is a program that I can feel very proud to be associated with. We hope the information you've heard today is relevant. You'll do something about it. If you feel those symptoms, your nurse, GP, or your pharmacist, ask the questions, and I'm sure they'll be able to help you. All I'm left to do now really is just to thank you, as always. We need people like you, yes. We do, and I hope that this has been an education for you today. All I can say is you're the head, not the tail, and take care of yourself. God bless. Welcome to this community engagement program. Now, I've learned something here which I'm just so excited to talk about. I've got Christiana here with us from the NHS, and she deals with virtual ward. And you may say, what is that? Well, you're going to hear about this when we hear so much that there's hardly any room for anybody to go into the hospital. Now they're doing it virtually. And I always say, if you're not digital, you'll be invisible. And the NHS has gone to the next level. Let's welcome no other than Christiana.
Good evening.
Oh, well,
No,
never mind. I'm glad you're here. Whatever time it is, you're here. So I'm grateful. Look, Christiana, I'm so excited about this whole idea of this virtual ward. Tell me a little bit about it.
Okay, virtual ward is, what do you call it? It's one of the government's, what they're encouraging for care in the community, instead of always being hospital-based, is bringing the care to the people in the community.
So you mean, instead of going to the hospital comes to you?
Exactly. So
wow.
It's like hospital at home.
Hospital at home. So how do you manage to do a hospital at home with all the instruments and the beep, beep? So what's the technology behind that someone can be cared for at home?
Yeah, it's been simplified, but what happens is there are kits that we give to you that you use at home. And these kits are very simple. It's like either iPad or like a phone. And depending on what kind of monitoring we're doing, there's also like a watch like you have. It's not your ordinary iPhone or Apple Watch. These are medically approved devices that you can use in the house that will record your oxygen, your pulse, your respiration, things like that. And we can also monitor your blood pressure. And we
All
use
from
remote-
this watch
Well,
type
not your
of thing?
blood pressure. Your blood pressure is still your normal technical blood pressure machine, but the others can do that. the
Okay,
one that
let's
you
look
do.
at this. So what we're saying here, something's going through my head about this. You know, you've got. I think I'll have to come to you about the corridor situation because prevention better than cure. But let's take that later. So what you're saying is, you are able to monitor individuals from home with this new bit of kit technology and answer the call. Meaning, suppose their blood pressure hit a low or hit a high, you will be able to respond by what you've seen concerning that individual.
Yes, once the patient has done their blood pressure, it comes through to us where we are in our office.
Hold on, you
on
said the patients,
dashboard.
they actually take their own blood pressure?
Yeah, they're given the kit to do at home. And then, you know, whatever the recording that they get, the data comes through to us. And, you know, we can see it if there's a need for concern to then call the patient via video, like almost like doing a WhatsApp with the patient on the screen. And we, you know, we talk that way and we advise and care.
How long has this been going on? I mean, this is new for me, virtual ward. How long has...
It basically started during COVID because of the pressure on the NHS with beds. So some, you know, it started off small with pulsometer, people just going home with the monitor to make sure their respiration and things, you know, they was being monitored. But it's grown bigger since then, and the government is encouraging it so that we can do more care in the hospital and not put so much pressure on the NHS in the hospital. As you've mentioned, you know, with the corridor situation.
Yes.
This, you know, when you are in hospital, once they've done the initial assessment and they've like stabilized you, you know, patient can ask, can I go on the virtual ward? There'll be someone that will assess you to see if you're suitable. And then, you know, you can, if you're suitable, be allowed to be nursed in the virtual ward, in a remote monitoring, as we call it.
Okay, so if they get that assessment, has somebody have to be in the home to make sure that they're okay as well?
We usually encourage people to have someone at home that can be of support for them, because not everybody is digital, and we don't want to exclude anyone from the care. So even if you're, I mean, we have a lot of our patients say, oh, I'm not tech abled, I can't do that.
Well, we do get that, yeah.
You know, but we can still manage them, because once they're set up, it's not as scary or that technical. And at the moment, with the pressure on the NHS, we're getting a lot of people who've had, you know, who've got flu, you know, whether they've had the vaccination or not, but they've caught the flu. And so once they're started on their antibiotics, they can go home, and the rest of the recovery is at home.
Okay, now let me go back. The tech. My word is, if you are not visible, if you're not digital, some of you are going to be invisible. Now, we're talking about elderly, and sometimes there is a big struggle with technology. And I'm sure behind the scenes, the NHS is doing something that tech is accessible, it can be used, because although you may have this virtual ward, if they're not tech or have an idea about this, then we're back to square one again, aren't we? So is the package, in a sense, would you say, good enough that anybody can use it, that they can feel that they're getting that virtual ward care?
It is.
From your perspective.
It's available for anyone and everyone. Our average age is probably around about 75.
That is using...
Yeah, because we have a lot of our frail patients where the hospital is not the best place for them to be when they're not well, because they're vulnerable, they can catch, you know, other things. We're talking about, you know, RSV that can turn to pneumonia and things. So if we can bring them out of an area where they're vulnerable back into their home, in the safety of their own home, where they're eating their own food, you know, they are not surrounded by people with other infection, you know, we have them at home. And so It is, because it's not a case of they're giving the packet and say do it at home. The nurse will help to set them up, and we are there to monitor them. If they're having struggle, we have technical support that will phone them and help the patient, and the nurse will still go in if it's necessary.
How successful would you say this new virtual ward? How successful would you say it is? Is it?
It is. This is our 3rd year here in Southwest London that we've been doing it.
And the reports have been good that you're seeing, the stats?
The patients love it.
Because they're in their own environment.
They're in their own home. They're still getting hospital care. You know, we have consultants, we have nurses like myself, and we have matrons, we have the pharmacy. We meet with, together every day to discuss our patients, and they are told about it, so they know. The only difference is they're not in a hospital bed.
Okay, so therefore, for you as a nurse, how many people would you have to monitor?
We are a team, so
a team of how many? And how many people would that team take care of?
No, let's talk more about the capacity of the ward that we run is 50 beds currently. So we can take up to 50 patients.
You can
virtually? Virtually, yes.
50.
And that service is not just for Croydon University Hospital. We also look after Kingston and Richmond, we look after Sutton, and
So this is in majority of most
Southwest London area.
Wow.
4 different trusts that we cover.
So with the NHS, this is not a pilot now. It's something that's been done in almost over 600 hospitals in the country.
Yeah, it's part of the NHS service now.
That's very good. Now that leads me nicely on to the whole idea of these beds in the corridor. Now, I'm not here to make on record to bash the NHS. I thank God for it. Many countries don't have this, but the beds in the corridor situ, are we trying to say we want to leave? That could be alleviated by them getting the care virtually at home.
Yes. For some patients, it is possible. I mean, there will always be patients who need to be in a hospital.
Of course.
Because of their condition. But there are others that can be assessed for being suitable at home, to be virtually cared for. And, the other word we like to use is hospital at home, because it's the same hospital service we're trying to give you, but in the comfort of your own home. And although you're virtual, it doesn't mean no one never goes in to see you. If we're concerned enough, one of our nurses will still go in and see you. We work with the district nurses. If they still need to come and see you to do your dressing, they will still go in and see you. But we're just providing another branch or pathway of care.
So what we're trying to say again, we're trying to prevent anyone trying to catch any of these viruses. And that virus can also be taken care remotely as well from home.
Yeah, I mean, they would have already caught it, unfortunately, if they were in the hospital. What we're trying to do is make sure that it's not exacerbated or it's not made worse by them catching other...
Yeah, on top of... Yeah.
On that, other hospital-acquired infection, you could say. So if we can nurse them in the environment and the safety of their own home, then that would be
to make sure they...
But the best bet is always prevention, as you've said. Have your vaccination. Those who are vulnerable, and for us in the Black community, because we are very close knit, we have there's more vulnerability in all this infection and passing it on one to another. We may be looking after our grandparents as well as our parents, and so if we can prevent them from even getting these diseases by getting the vaccination first, then the need to go into hospital and be in a corridor can be avoided. But for those who don't, you're not going to be rejected by the NHS, never. You will still be cared for. And unfortunately, the hospital in the corridor may happen until you're assessed. And then, if you're suitable, you can go onto a virtual ward. Even if it's not mentioned to you, I'm here now saying to you, ask if you're suitable to be nursed on the virtual ward. The doctors, the nurses are aware that we're there. It's a service for our community. Ask, and they will say yes or no, whether you're suitable, and
Well,
that can be done.
Well, it's new. As I said, I've never heard of a virtual ward before, and to know that it is accessible by asking. That's why I love programs like this. I mean, if I had to ask you as well, are you saddened to see people in the corridor?
Absolutely. That, we didn't train to be nurses or doctors, to be nursing people in the corridor. It's not the most dignified way of looking after people, but at least they still will be careful rather than not, because it's from there you go onto a bed. But it's just, the waiting area you go to, unfortunately, because the pressure on the NHS is more than it can cope with at the moment, especially with winter, with the flus and the COVID, and people are still falling and breaking their legs, and all, they're still having other kinds of medical conditions. So it's not a choice that any hospital wants to do, but it gives the patient still an opportunity to be seen.
Yeah, I mean, many people are saying they may get the service, but their dignity is at stake. And many of them, I've heard so many, want to go to the toilet, they can't, they have to wear, like a nappy, whatever. So I think that's the cry. They may get the best service possible, but I think it's just their dignity, isn't it? The dignity, that's...
the delay, nobody wants to delay your treatment, but you've come in a line of other people waiting to be treated, unfortunately. So, and it's not the best, but it's what we're managing with the pressure that the NHS is under.
I went sideways because I just wanted to address that. It's something that we're hearing more and more about, and you've seen it firsthand. I hear that, but I want you at this moment, and I know we've spoken before, and I'm really grateful that you take the time to come in, but just use the camera as a way of letting people know that this virtual ward is so important. It's out there. It's something that they can access, because many may not have heard until you've just mentioned. So could you just speak to somebody at this moment going through the symptoms, feeling the way they feel, to say this is something that they can also access? Yeah,
the virtual ward is for everyone. It's part of the government's next sort of 10-year plan to bring more of your care into the community, so you don't have to go into hospital, so you don't have to be in the corridor, but that care can be given to you in the home. It's no less, it's still NHS care, it's still nurses, there's still doctors, consultants, there are pharmacists, we're all there, but we're just remotely, but we're given the kit for you to use in your home so that your care continues. And I would just say the best thing to do while we're talking about winter pressures is get your vaccinations. For those who are vulnerable, we're talking about the over 60s, we're talking about our pregnant ladies to protect themselves and their babies. We're talking about our vulnerable BME community, with all the other comorbidities that we have. Have your vaccinations, your RSV vaccination, so that you don't get to that point where you have to go in a hospital and you are in the corridor before you are seen. But what I want to give the goodness is, if you are in a hospital, once they've done your assessment, your baseline, and ask right at the beginning, saying, whatever happens, will you consider me for the virtual ward? I want to be cared for in my home. There are nurses within the hospital that will be called to come and do your assessment and see whether you're suitable to be cared for in your home. And it's going to be basically hospital at home care you will get, but you just have the kit in your home, knowing that at the end, all the data that you're sending is going onto our screen, a dashboard that where we are based in the community, that will be looking at you. And if we're concerned, don't think we won't come out to you. We work as part of the local virtual ward. There's quite a few of them who, a nurse will still go out and see you if they need to. Some of them have doctors that will still go out, to your home and will still see you and assess you and, do the care. So at no point are you neglected. you are still getting NHS care. It's just in a different way. In the comfort of your home, you're eating your own food, you're in your own bed, you haven't got somebody else crying next to you, or, you're at home and you can move about and, eat, drink, whatever you're normally doing. You're not having to wait to tick, the menu and all that kind of thing. And you're covered 24/7.
It's a good idea, very good idea. And very lastly, how important are programs like this to get out to the community?
It really is important to have programs like this because we're not always informed of what is happening within our local community, the healthcare. You can Google some things, but it doesn't always say what your community, like your NHS, can provide.
That's right.
Croydon is so blessed in many ways that it has so many different programs, but that people don't know. So listening to things like this, you pick up and let others know, and, just spread the word that there is an alternative to being at home. But obviously you have to be assessed as being suitable for it. We want to include as many people as possible. So it's not a case of, I'm too old or I'm too young. Our oldest patient we've got at the moment is 95.
Wow.
We're using it with her. She's got a daughter, around and about her, but she's in her home and she's being cared for.
Brilliant.
And, she's much more happy at home than being in a bed. She's scared of being in the hospital, in case something happens to her. So,
she's in her own environment.
She's in her own environment and still getting the care that she needs.
Thank you so much. Well, you heard it. You heard it straight here on this community engagement program. And you will be silly not to take this and digest it and share this particular program with others.
Can I just say, It's not just for people in Croydon University Hospital. If you're in St Heliers, it's part of the Southwest London, and Epsom, they also do the local virtual ward. We look after them. So it's in Sutton area, Kingston and Richmond we cover, as well as Merton and Wandsworth, who are sort of covered by St George's.
Wow.
So, but you just have to ask whether you're suitable and ask to be assessed for it.
As I said, you heard it here. I really hope you have been enlightened. Thank you so much, Christiana. For the second time, we've been talking. As I said, these programs to me is a great field of education, and I feel a conduit, making sure we can pass on the information, because you said we are sometimes uninformed, and this is the program to make sure you get the information. So thank you. Thank you for your time, and I hope that you enjoyed this, almost said service. Hope you enjoyed, well, it is a service that you're offering anyway.
Absolutely, it is a service.
It's absolutely.
Yeah.
So I just hope you enjoy this program. And I trust if you need any information, we'll have it on the screen. So thank you for watching. And remember, you're the head. And I always have to say, prevention is better. Thank you. God bless.